So my name's Mel Norris. I'm a senior staff nurse at York House, and then I've been a senior nurse for the last 9 months. So I think that BIRT is different to other settings, other sort of nurse-led or psychiatry-led, because it is psychology-led, but the nurses still get to do as much, if not more, as they do in other settings. So I've been on assessments, take part in capacity assessments, go to the multidisciplinary team meetings, get to be involved in all aspects really.
My name's Helen. I'm the Divisional Head of Nursing for the Brain Injury Rehabilitation Trust. Working for BIRT, we're working with a full multidisciplinary team within our services and within our hospitals. That's something that is completely different to the NHS. You actually have them to hand. We're working as a team, working towards progression and independence for service users. We are able to set goals for our service users and support them. So working for BIRT, you'll be working with a neurobehavioural model. That's something that I'd never used in the past. It was always very much nursing models, but this is very much a multidisciplinary model that incorporates all of the different roles used within the services. It's basically providing positive reinforcement to people when they're actually doing something really well. It's errorless learning, so it's actually repeating the same tasks over and over again until somebody gains independence, or as much independence as they possibly can. We're working with people to reach their absolute maximum potential, something that isn't ever available in any other services that I've ever worked in the past.
I think it means that the service users just get a really holistic care provided from us, because they don't have to wait to see professionals, and we can provide the best care and do it fairly quickly. So the assessment all starts to take place as soon as somebody is admitted to us, and within a few weeks we can build things up a lot quicker than I think that you can in a lot of other places.
It's really important for us that we work closely with families, because it's not just a service user that the brain injury does affect, it's the whole of the family. It can be the main breadwinners, they've had full-time jobs, their mums, their dads, it can be anybody, it can hit any of us. But working as an MDT, we can actually ensure that that family gets as much support as we can in the future.
I think what makes BIRT different to other rehabilitation providers is the multidisciplinary team, the fact that we've got so many experienced clinicians all working together to provide the best care we can.
We're the leading providers in the UK of brain injury rehabilitation. We do have the multidisciplinary teams within every service that we provide. And we're basically reaching the goals that service users have been told often that they're not going to meet. We have our own clinical executive as well, which is basically a group of psychologists and clinicians and allied health professionals, including nurses, that meet on a monthly basis and look at research, and we look at guidance and things and best practice, and ensure that we're actually delivering a progressive service, not just staying the same as we always have done. There's also lots of training opportunities as well that we have within services, both locally and also throughout the country as well. We have nurse training days in our hospitals on a bi-monthly basis, and where we actually encourage external providers to come in and do training, and also we provide training within the services as well to ensure that people have got the best knowledge that they have for their ongoing practice and service, due to the fact that our service users can be quite complex.
Our job at York House is to rehabilitate the clients so that they can live as independently as possible. We teach them the skills that they'll need to live in the community if that's possible, and just try and give them all the tools that they can to live as independently as they can.
The benefits and the satisfaction that you get with working with people to meet their goals is absolutely so worth it. I can't tell you the amount of times I've been in tears because I'm so happy for the outcomes that we've achieved for that service user and supported them to do it. It's just been amazing and continues to be.
The thing I like best about the job is spending time with the clients and just getting to know the clients for who they are, because whilst they've all got brain injuries in common, they're just all so different, and they've all got different qualities and different potential for rehabilitation, I suppose. They're all so different.